Aortic dissection. A patient can be asymptomatic or complain of chest or abdominal pain. They likely will have extremely high blood pressures. Treatment. You need to lower the pressure to prevent further rupturing. Use either labetalol or nitroprusside with a goal of systolic blood pressure around 120. The dissection will either be type A or occur at the point where the aorta exits the heart and requires immediate surgical consult. A type B dissections occur in the lower descending aorta. It is treated medically by controlling the blood pressure. Aortic. Sometimes a dissection can be noted on chest x-ray with a wide mediastinum. Usually the test of choice is a CT with contrast. Prevention. Get an ultrasound on certain aged smokers. If 5 centimeters or less, you can do routine observation. If 6 centimeters or more, or quickly increasing in size, then refer to surgery.